Sai Ram, dear brothers and sisters. All of us are aware of taking responsibility to maintain our health. Today, we have a great practical session on how to preserve good health and well-being. Brother Kavi Mahalingam is an advancing physiotherapy practitioner with 16 years experience in musculoskeletal, neurological, and cardiorespiratory conditions, with special interest in neck, shoulder, back, and knee conditions. He completed his bachelor's degree in Tamil Nadu, India, and master's degree from Coventry University. Currently, Brother Kavi works as a community senior physiotherapist in the East Suffolk and North Essex NHS Foundation Trust and is also actively involved in research. Brother Kavi was a Bal Vikas student since 2008 and has been involved in medical and blood donation camps. He has conducted yoga classes for children and has done community cleaning services in India and Malaysia. He strongly believes in and follows Swami's message of love all, serve all. Jai Sai Ram.
Thank you, Dr. Arul, for introducing me. I would like to thank Chelmsford Science Centre to provide this opportunity to speak about a very important topic. Well, first of all, good evening to everyone. We will be discussing about a very important topic, which is posture. Better posture is always shows that we are in better health, as yoga teaches us. Let's get into the topic. Good posture is about more than standing up straight so you can look your best. It is an important part of your long-term health, so make sure that you are holding your body always right way, whether you are moving or sitting still. So definitely I'm saying that it would help preventing you from getting pain, injuries, and other health problems. Posture is usually defined as the attitude assumed by the body. Um, every one of us having an attitude. The attitude describes whether a person is a kind person or um, rude, or he's a down to earth, or yeah, like that. We have several attitudes demonstrating our character. Similarly, posture is defined as the attitude that is assumed by the body, either with support during the course of muscular activity. Definitely we know that the human body is made up of bones and the muscles, so in order to adapt a posture, the muscular activities are really very important to hold our body in a position against the gravity. So it is an thing that always interacts on our body. So as a result of coordinated action performed by the group of muscles and the gravity, it helps to maintain our stability. Usually, posture is divided into two main types, which is a static posture and the dynamic posture. So most of us are now in a static posture. That refers to the body and its segments are aligned and maintained in certain positions. For instance, so most of us are sitting. Standing would be the another best example. Lying down would be another best example for the static posture. So when it is coming to the dynamic posture, anything that is moving um, are termed as dynamic posture, something like walking, throwing, lifting an object. So it's always an important thing to make sure that you have good dynamic and the static posture. Every one of us are having posture. So that posture may be good posture, maybe a poor posture, or sometimes it would be an ideal posture. So on what basis it is told as an ideal posture or good posture or poor posture? So the line of gravity, which is really very important thing, as I told, the gravity is always an external force that is exerted by the earth to hold us to the center of the earth, so which is gravity. So ideal posture is one in which the body segments are aligned vertically and the line of gravity passes through all the joint axes. So good posture, so the line of gravity falls close to but not through most of the joint axis. So we should note that the ideal alignment is always a mechanically efficient positioning for the body. So here we need to think about what is line of gravity. So line of gravity, it is nothing but an imaginary line that is intersecting our body and passing through. It is something like, the gravity is making a connection with our body. So the force, it acts through the joint axis. Joint axis is nothing but the joint uh, union. When two bones are uniting, so that is called as a joint. So that is called as a joint axis. And the line of gravity is an imaginary line that is going through the joint. So for instance, if you imagine a door, so door has the hinge, and from there the door opens and closes. So the hinge is the point where the movement takes place. So and going in and out, that is the surface. So similarly in our body, there are several types of joints: ball and socket joints, hinge joints, right? So like that we have several joint types. So our body works in that way. Our body should be aligned in a good way, so because that is the foundation that allows the muscles to work most effectively while putting the least amount of stress on the joints. What does the effective term says us? So the muscle work to be less and the output should be more. For instance, if you need to do a work, okay, so you are doing that work without any extra strain. That shows, yes, your muscle has good endurance, which is the capacity of the muscle that can able to work for longer duration of time without getting tired. What happens in poor posture? So in poor posture, obviously the muscle stress will be more, and joints will be put under too much pressure, stress, and always we will be less efficient in balance. For example, if you look into an healthy young individual and an older person with a poor posture, who will be more stable? Obviously, the young individual with good muscles and the posture will be staying stable rather than the elderly people. So this is a kind of debatable. Not all the elderly are having poor posture, and not the all young people are having good posture. It's debatable. I just told for an example. Posture is certainly influenced by your muscle tone, your height and the weight, gravity, surface, task, what type of work that you're doing, duration, how long do we do, um, our level of health and well-being, and definitely the emotional status is really very important. So muscle tone. So muscle tone if we have good muscular length and the strength in our muscle, so we would be able to fight against the gravity, and we would be able to maintain a proper posture. So height and the weight. A person who is taller and a person who is shorter. You know, the posture differs. When a person is tall, they tend to stoop forward. The height between the gravity and the location of center of gravity is bit different. You know, in a human body, the center of gravity is located near the second sacral vertebrae level. Second sacrum is something that, you know, near your lower hip level. So that's the reference point where the gravity, the center of mass is in. But it differs from the position to position. When you're sitting, when you're holding on something, the center of gravity varies in position. So gravity, yes, absolutely. The gravity is really very important, and it is influencing the posture and the surface. For instance, walking on a hard surface and walking on a soft, squashy surface makes a lot of difference. In a soft, squashy surface, the gravitational force, the gravitational effect will be less when it is compared to the hard surface. That's the reason when you're falling on a soft, squashy surface, you're not getting injured. On the other hand, on a hard surface, you do. And duration and the task, what type of work we do, like sitting and doing a computer work, or doing some heavy body work. Okay, so that do matters, and that do influence your posture. How long? So sitting for a longer duration of time will definitely make you to adapt a poor posture, and your level of health and well-being, emotional status. If someone is sad and depressed, they obviously stoop and sit with a dull posture. But if you're more energetic, you will be more upright and you will be graceful. So muscular dysfunction is something that, like muscle spasm, pain, tenderness, reduced strength and flexibility, is always causes a poor posture. So this is a picture that shows the side view of a human standing straight. So you can see a line which is passing through, that is the imaginary line. On the picture on the left hand side, you will be having a straight continuous line, and the right side you will be having a dotted lines. So it indicates that the line of gravity. So if you look into it, it passing through the ears and spine. And if you see the thoracic spine is something like your body, the upper body. So it goes forward. That's the reason you tend to bend a little forward, and the line that goes backwards makes your hip arched backwards, and it goes through the hip joint, knee joint, and ankle. You know, when the line of gravity is intersecting the body properly and passing through the joint axis, you will be definitely having a good posture, and your muscular endurance will be good. If it is going beyond the range, then it results in a poor posture. We will see that in detail. Before looking into that posture, we need to understand what is ground reaction force. So, as I told earlier, you might be very clear about gravity. Gravity is an external force that is exerted by the earth to keep our body to its center. Let's say everybody weighs different. For instance, one person may be weighing 70 kilograms, and one person may be weighing 100 kilograms, and one person may be weighing 40 kilograms. You know, among these three people, who will be having more ground reaction force? Definitely, the body weight does matter. So, the higher one, the person who weighs 100 kilograms will be having the more ground reaction force. What is ground reaction force? How much amount of weight that you are bearing on the ground, the same amount of weight will be given back by the earth. Okay, so every action has an equal and opposite reaction. So Newton's third law, I think most of you might be aware. If not, yeah. So this is something like when you give something, you will get back the things like a karma. Same thing like that. The ground that gives you back the same amount of load that you are bearing it on the ground. So that is ground reaction force. When the ground reaction force is acting on the bones and the muscles, if you are not having a proper muscle flexibility or strength, then obviously the load will be more on the joints. If the muscle is not holding it properly, you will be having the joint compressions, and the extra load will be making your posture poor. And the next important thing that is important is the base of support. Always the base should be strong, then the building will be strong. So the base should be wider to have a good building. So similarly, the base of support, that is the area bounded posteriorly by the tips of the toes in case of human. So center of gravity, as I told, the center of the mass. So where the majority of our body load is concentrated, that is the center of the mass. So that is the point where the line of gravity acts. So if the center of mass is slightly forward, for instance, if a person is pregnant, if a lady is pregnant, then obviously her center of mass will be moving slightly forward because of her tummy weight. So the gravity location will be moving slightly forward towards the heavier side. So then the low, then her posture will be altered. Like the arch at the lower back will be increasing. Why? The body adapts the position by itself to prevent from falling. So always, if you look into the human body, the base of support is less small. But if you look at the center of gravity, it is more higher. So that's the reason, like a tall person, the center of gravity is very high and the base of support is lesser. So they, if you look at the people who are tall, they try to keep the leg bit wider. I may be wrong, but if I think we need to do a lot of observations to analyze how the people are balancing themselves. If they are not balancing themselves, then you could see definitely the posture would be poor. So because the body changes that, body takes that opportunity to adapt itself to maintain the balance. So observing the body, how it is, arranged, is a skill called postural assessment. The key to good posture is the position of the spine. Usually, the spine has three basic curves. One is at the neck, and the upper back, and the lower back. So these are the area the curves will be. But when a baby is born, they will be having a flat posture. Once they start to stand, the gravity takes more action on it. So, and then the arches will start to develop. So that's why the babies won't be having the proper posture. So fine. So correct posture should maintain these three curves but not increase them. So if it is increased, then that results in the postural problem. Or if there is no curve, then again it's a problem. You should be in the neutral. So your head should be over your shoulders and top of your shoulder should be over the hip. That is the reference point, how it should be aligned. So how the posture can be assessed? The posture can be assessed using the plumb line. So plumb line is something like the builders will be using to see the level of the wall, whether it is straight. So that is a normal plumb line. So we can use the same plumb line to do an evaluation to find out whether the joints are aligned properly. The second thing what you can do is you can simply click a picture of yourself in side view, front view, at the back view, and then you can use a stick or a small thread and you can just measure to see how your posture is. These are the way of postural assessment. So we have advanced level as well, but most of the time physios will be using either the photography method or the observational method with the plumb lines that is more reliable. So when we view a person from the front back, the vertical line passes through the body center of gravity. So theoretically it should bisect the body into two halves, with the body weight distributed evenly between the 2 feet. So what are the things that we assess when we are assessing a posture? We have to see the symmetry, whether it is equal to the right side and left side, front and back, and we have to see whether the structure is rotated and or tilted towards one side. And some people, when you see, they'll be raising the shoulder to one side and the other shoulder will be downwards. So in that case, you can see they could be having scoliosis, which is the C-shaped curve in the spine. So, and if you see when a person is viewed from the sideways when they are stooping forward, so it could be a forward head posture and the kyphosis, so which is most commonly seen in the elderly people and in the IT population. Well, so what are the things we need to assess? We need to see the head alignment. We need to see the cervical, thoracic, and the lumbar curvature. So the curves in the neck, upper back, and the lower back. So we have to see the symmetry of our shoulder level, and then we have to see the pelvic symmetry. So if there is any pelvic asymmetry, then we can assume that the patient might be having a scoliosis, so C-shaped curve in the spine. So we have to see the hip level, knee level, and ankle joint levels. So this is the picture that shows, looking at the eye level, looking at the shoulder level, the hips, the knees, and ankles. So in the side view, you can see this gentleman who is having the ideal posture, so passing through the ear and slightly, through the shoulder joint, through the spine and hip, knees, and ankle. So it's an ideal posture. So we need to slightly discuss about the biomechanics. Biomechanics is something that the body engineering, body mechanics. So when the line of gravity passes through the joint axis, what happens? There is no gravitational torque. So torque, what does a torque means? It's a force that causes the rotation. Okay, so around the joint axis. So simply to understand, I'm not going to complicate that with too much physics term, but still it's worth understanding. So it's something like empowering with knowledge would make you to correct yourself rather than getting the advice. Okay, well, so if line of gravity passes through a distance from the axis, then the gravitational torque is created. So that's why, so the line of gravity should pass through the joint axis. If it is passing away, for instance, if it is moving forward, then that causes the body to bend forward. If it is going backwards, then it tends to push your body backwards. So this torque will cause rotation of the superimposed body segments, and so what happens then? The gravity need to work harder. So there will be a fight happening, a tug of war happening between the gravity and your postural muscles. So when which one is succeeding? Obviously the gravity. Then if your muscle is weaker, then you will adapt shortened muscle because of the poor posture and results in pain and other health issues. So I think this is an best example. You can correlate that. So first let's take this picture on your left hand side. So you can see the thigh bone. This small round is the knee joint and this is the leg bone. So the line which is going through is the line of gravity. When it is passing through forward, it causes a forward rotation, and when it is going backwards, so it causes a backward rotation, as I told earlier. I think every one of us make sure like how we are sitting. So make yourself upright, sit straight, and adapt the position on the right side. So that is the ideal posture. So if you see this picture on the left hand side, see his neck, how much stooped. So mostly when we look into the computers, we will be going for this position, right? And this is a leisure sitting with the back not rested, so going backwards. So when it is going backward, the gravity tend to pull your head slightly forward, so which is not an ideal thing. And this is the ideal posture. So the line of gravity passes through the joints, so that reduces the load on the joints. This picture will be giving you a very clear idea. So there are three pictures, which is an active erect sitting, and the relaxed erect sitting, and the slumped sitting. Definitely, which one would be the best? The active erect sitting, because the line of gravity is closer to the axis, so the muscle work will be lesser when you're going for an active erect sitting. So the B, relaxed erect sitting, I would be saying that it's relatively close. So it is also a good position, because we are not robots, or we are not stone statues. So we can't be adapting the same position always. So, but it's advised that you should not stay in the same position for longer period of time. So other than that, it's good. But if you see the slump sitting, the picture number C, so definitely the line of gravity is falling forward, so it pulls, and what happens, the muscles at the lower back, upper back, and the neck goes for weakness and tightness. So definitely the upper back will be tight, and the neck is stooping forward and going, and it is tilted backwards, so that causes definitely the tightness in the neck muscle, and the forward neck muscle will go for weakness. When you're sitting on a chair or sofa or a settee, so make sure that ears are aligned with the shoulders and the shoulders are aligned with the hip. The shoulder should be relaxed and the elbow should be close to the side of the body, and that's the reason it's always a good idea to have a chair with the armrest. So the angles of the elbows, hips, and knees are approximately 90 degrees. So make sure that the feet are flat on the floor. So forearm are parallel to the floor with the wrist straight. So it's an ideal posture when you're working with a computer, not only with working with a computer, so working on the desk, or sitting and eating. So that's the best way. And your feet should be resting comfortably. Always, it's a good idea to avoid crossing your legs. So you're twisting your pelvis, and it's not a good position to have the proper muscle length and the blood flow. Well, so I'm sitting in a proper position, but can I sit for a longer period of time? Definitely no. So even though you're adapting a proper sitting position, it is not always a good idea to sit for longer duration. So what is the duration that you can sit on a chair? Let's say every 30 minutes, try to change the position. So maybe you can keep the things away. So keep your water bottle in your vision, bit away from the computer, and try to have the things spreaded across. Don't keep everything in your closer proximity, then you won't tend to get up from the position. So always try to keep the things bit away, then use that as an opportunity to get out of the chair. And if you're working too much on the computer, definitely you're going to end up in problems. So sedentary and sitting behavior in the office workplace is a risk factor for cardiometabolic diseases, type 2 diabetes, obesity, coronary artery disease, musculoskeletal disorders, and even some type of cancers and premature death. So the studies shows that increment of each 2 hour in sitting time, the risk of obesity and diabetes increases by 5 and 7%. So in contrast, prolonged sitting behavior raises the risk of musculoskeletal disorders, especially the low back pain. So these are the standing postures. So you can see the abnormal postures, how people adapts. So this is the ideal posture. So when you can see the forward headed, thoracic, lumbar, and the sway back. All these are the abnormal postures. So in a lordotic posture, obviously the pressure will be more on the lower back, and because the pelvis is tilted anteriorly, so they'll be having problem with their knee. So the knee cap tend to rub against the bone and results in chondromalacia patella, and they are more prone for the low back pain. Sway back posture. So in this sway back posture, obviously there will be a hyper extension of the cervical spine and a flexion of the thoracic spine, and the pelvis tilt posteriorly. They'll be having mostly the flat back posture. So they'll be having the tightness in the tummy, and they are more prone for the hamstring issues as well. So flat back posture. So in this type of posture, the head will be forwarded, an extension of the cervical spine. So so they will be having lordosis, as well as the pelvis will be tilted in the opposite way. Scoliosis is another important thing that we need to look into. A deviation of the normal vertical line of the spine. So, scoliosis is considered when there is at least 10% of spinal angulation on the posterior anterior radiograph associated with the vertebral rotation. So, when the spine is going towards the C shape, so it is not only going to change, so it's going to twist and change. So it's really a very difficult thing. So it's a good idea to identify the scoliosis at the earlier phase, and before it is getting fixed, it's a good idea to treat. People with the osteoporosis and in the elderly age population, they'll be having more of kyphosis, and some patients I'm seeing like kyphoscoliosis, kypholordosis. Kyphosis is something like the increased convexity on the upper trunk, just stooping forward. So we saw about sitting for a longer duration. What are the demerits? So similarly, if you're standing for a longer time, so there is an oxidative stress. Oxidative stress is something that imbalance between the free radicals and the contracting detoxification process. It's a kind of metabolic activity that results in blood pooling in the lower limb. So when you're standing for longer period of time, definitely the arterial pressure, the arteries that carries pure blood, the pressure in those vessels, it will be uh, lesser in the upper body, and it will be higher in the lower body. So that's the reason, like, most of you are getting leg pain initially, because the pressure is too high on the lower legs. So when you're standing, and at the same time, if you're wearing a footwear which is inappropriate, your problem is going to be doubled up. So musculoskeletal pain, mainly spasm, fatigue, back pain, and cramps are more common if you're in standing position. So 50% of people who have no complaints of low back pain also experience pain due to the ground reaction force. So young adults aged between 18 and 30 were just likely to experience long-term fatigue as were workers over the age of 50. So age doesn't matter. What you do, that's matter. Pain, every one of us might have told, I got this pain and that pain. It's an unpleasant sensation or emotional experience which is associated with the actual or potential tissue damage, or described in terms of such damage. So what causes a musculoskeletal pain? The wear and tear, trauma, postural strain, your abnormal posture, which is why we are discussing today, Repetitive movements, overuse, prolonged sitting or standing, our poor body mechanics, mainly the spinal alignment problems and the muscle shortening. Either sitting or standing, if we do that for a longer period of time, what happens? The prolonged static posture that results in muscular fatigue and the imbalance. That results in muscular ischemia. Ischemia is something that, lack of blood flow to that specific tissue. So when there is a lack of blood flow, what happens? The tissue cells die. So that's called the necrosis. um, let's say like in a farm or in a pathway, if there is no water and that becomes dry and scaly. Once after the water pools, that becomes supple. Same thing happens to the muscle. If we are doing the things for a longer period of time, the blood flow is restricted, then the structures will start to die and become, rough and hard. So when there is a muscular necrosis or ischemia, that results in trigger points. So trigger points, we will be seeing what trigger point is in a while. So before that, it causes, if a person is having trigger points, then they'll be having pain. So because of pain, what happens? Our body starts to protect the other area, so it tends to become spasm, the protective muscle contraction. So every one of us might be facing in the neck and the back. So when it is happening in the upper body or in the trunk, it causes the spinal disc degeneration. Why? Because the load on the spine that causes the degenerative changes, the cell death that takes place. So when there is a degenerative changes, the joint space reduces in the spinal column, results in compression because the nerve roots come out of the spinal column. So when there is a compression that starts to press your nerve, that results in nerve compression, obviously results in the musculoskeletal problems or disorders. This picture clearly explains what the trigger point is. Here you can see a reddish discoloration in the muscle. So that is the area where the trigger point forms. And when you touch with a finger, you can feel that and you can isolate it. So myofascial trigger point is a discrete hypersensitive nodule within the taut band of skeletal muscle and or fascia. So this can be palpated. So no other device would be showing you because we don't the scan or X-ray. Definitely X-ray shows the bone and the scan won't show the trigger points. So palpation of this nodule reveals an area of harder than the normal consistency. So trigger points are usually classified into two. One is latent, another one is active. Latent is something that we ourselves don't know whether we have the trigger points or not. Until it is touched, we may not know we have the trigger points. It causes spontaneous pain but may restrict the movement or cause muscle weakness. An active trigger point causes pain at rest. A firm pressure applied over the point usually elicits a jump sign, like with a patient crying out or winching or withdrawing from the stimulus when you press that. So it is tended to palpate, and the main thing that we need to know in the trigger point is like we will be having the referred pain. The patient will be having referred pain. So referred pain is something that when I'm pressing here, the patient might feel pain and pain over here. So that is referred. Um, this referred pain is not felt at the site of the trigger point over the origin, but rather in a remote point. Usually the patient will explain the pain as spreading or radiating pain. So it is the important characteristics of the trigger point. So it differentiates a trigger point from a tender point, which is associated with the pain at the site of palpation only. So trigger points are palpable within the muscles as cord-like bands within a sharply circumscribed area of extreme tenderness. They found most commonly in the muscles involved in the postural support. So what are the postural muscles? In case of posture, like the upper neck muscles and the neck muscles at the front, upper back, the abdominal muscles, your bum muscles, thigh muscles, hamstring muscles, and the calf muscles. So these are the muscles that always work against them gravity. So acute trauma or the repetitive micro trauma may lead to the development of stress on the muscle fibers, and it forms the trigger point. So in the technical world, technology world, definitely, so we would be adapting any of these positions. Let's say if we are in the neutral position in the picture, so there is 0 degree tilt in the neck. So the person is holding the mobile phone like this. So when you tend to take this down, you will be bending forward. So that increases the load. If it is about 15 percentage, the load will be as about 12 kilograms. And as lower you are going, it increases the load. And if you're holding that for a longer duration of time, what happens? You are straining your neck muscles and as well as the joints, the spinal joints. Slouching or slumping over can misalign your musculoskeletal system, increases the pressure on the spine, making it more prone for the injury and the degeneration, causes neck, shoulder, and back pain. It decreases your flexibility, affects how well joints move. It affects your balance and increases the risk of falling. So it makes harder to digest the food, difficult to breathe, and in women, this is the main reason for having the pelvic organ prolapse. So the risk of incontinence increases. So the relationship between posture and pain, there are many theories that bad posture is contributing factor in the low back pain. Some studies have shown that the improved posture and postural control are having the positive effect. It's a good news, definitely. So whom should you approach? Definitely physiotherapists would be um, the people who can help you with the postural related problems. Um, so we would be identifying the postural style and provide the hands-on treatment, posture correction exercises, and so the main goal should be to achieve the normal joint range of motion. So how can we achieve that using manual therapy techniques if it is needed? So then obtain the muscular length, the normal muscular length. If there is any muscular imbalance, the tight muscle need to be stretched and the weak muscle need to be strengthened. The next important thing is to have good endurance. So your postural muscles are going to work for a longer period of time. So we need to uh, increase the capacity of the muscle to work for a longer duration of time. So always two types of exercises are there. Doing an exercise with a lesser weight for more repetitions, that would improve your endurance. So we would be providing those kind of exercises. So normal nerve extensibility, the nerve tissues should be in the normal length. So we need to have the neural stretch, and we should be having the good spatial awareness where you are in the space. So provides the verbal and the visual feedback. So always looking into the mirror to do your posture correction and the exercises would be the best idea. The second thing is the taping. The kinesio taping would be helping you to create an awareness that your posture is deviating or in the normal position. So the next important thing is postural habits. So it's always difficult for the body to adapt to a new thing. So we have to slowly reinforce and correct the habit. Um, the postural correction exercises, which is really an important topic. If a person is having a forward head posture, it's always a good idea to do the chin tuck. So while maintaining the good posture, place your pointer finger against your chin while looking straight ahead without moving the finger. Draw your head directly backwards. Keeping your gaze parallel to the floor, return to the neutral, bringing your chin tuck back against your pointer finger. So 1 to 3 sets of 10 to 15 repetitions. 1, 2, 3, so like that. So that would be a good thing that helps stretching your neck muscles. So because in forward head posture, the chest muscles, latissimus dorsi, and your abdominal muscles will be tight, and your cervical flexors, that is the forward neck muscles, will be weaker. So we need to strengthen that. So before strengthening it, it's always a good idea to stretch the muscle first and then strengthen the weak muscles. So a person who is having the kyphotic posture, so definitely the upper back muscles, the chest muscles, latissimus dorsi, and abdominal muscles goes for tightness, and the weak muscles would be the middle and the lower trapezius, the upper back muscles. So in order to improve that, the resistance band, Thera band, is a best equipment that you can do the exercises with. You can do the scapular retraction, so that is bringing the shoulder blades close together with an elastic band. So elastic band gives you the resistance, and the scapular retraction takes to the position, and you will be achieving the goal of getting a good posture. So you can do this exercise for about 2 to 3 sets, about 10 to 15 repetitions. So rounded shoulders, the muscles that are shortened would be your chest muscles and the latissimus dorsi, and the weak muscles would be your external shoulder rotators, the muscle responsible for rotating your shoulder outwards. So the resistance band, ask someone to hold it for you the other way, and or you can tie it to some pole or anything that is more stable, and hold on with the hand and try to place the towel between your arm and the shoulder to adapt to the neutral position, and then try to take it outwards. So try to do this for 10 to 15 times, and 2 to 3 sets. So uh, you have to give rest of about 30 seconds to 60 seconds between each sets. Posterior pelvic tilt. So in the posterior pelvic tilt, obviously the hamstring muscle and the abdominal muscles will be tight. So and the weak muscles will be gluteus and the multifidus. We need to strengthen these things. And so this is a position to stretch your hamstring muscles. So you have to sit in the edge of the chair and keep your one leg bent and the other leg straight, and try to pick your toes facing the ceiling, and try to stabilize your pelvis and lean forward and maintain the position. So you have to hold that position for about 15 to 30 seconds, and then you can do the stretch for about 2 to 3 times. So it's always a good idea to do 2 times a day, and it is always advisable to do exercise for 2 days, third day to be the rest, and do the next 2 days and then the rest. So obviously you'll be allowing the muscle to regenerate, you know so because when you do exercises or stretching, you're causing the micro trauma to the muscle, so you're allowing time to heal. So that's good idea. I think personally I always use that with my patients, and the results was really very positive. So people who are having anterior posterior pelvic tilt and the knee valgum problem, valgum is like the knees touching each other. So all of them can do the bridging exercise, which is really very important. So you have to lie down flat. So the people who can't go on the floor, it's always good idea to do it on a firm mattress. So you can do the the bridging exercise and the side plank. So we need to think about the age, and some people, they might have undergone the hip replacement, knee replacement. It's always a good idea to speak with your physiotherapist before starting any exercises that has been told here. So patients with a forward head posture or increased spinal curvature or rounded shoulders. So we know that the chest muscles and the trunk muscles are going to be tight. So it's always a better idea to stand on the doorway, and you can place your arm in 90 degrees and try to maintain the neutral position. Keep one foot at the front and one at the back in order to maintain the stability, and try to push yourself slightly forward. You have to note one important thing: your legs should control how much you are stretched by bending or straightening your knee through the doorway. So you have to be careful with that. And whenever you're doing a stretch, you should have a mild to moderate discomfort. So it should not cause a real pain at all. It's not important. So just do a gentle stretch. That will be more important. Try to hold it for about 15 to 30 seconds, and do for 2 to 3 times. 2 to 3 sets. And in a day, if you could do for 2 times, it is more appropriate. So lateral stretch. So it's always a good idea to clasp the arm, move it outwards, and take it up, and then sideways. Or you can do as shown in this picture as well. This is a fantastic exercise for the postural problems. The cat-cow position, the forward head, the increased spinal curvature, and the people who have posterior pelvic tilt. So you can sit on a chair or a bed, but you have to make sure that your hip to knee and knee to feet, the angle should be about 90 degrees, and turn your palm facing inwards and leave it on the thigh, and try to stoop forward. When you're stooping forward, you have to breathe in and then push out and breathe out. So you have to hold that position for about 10 to 15 seconds, and then keep repeating it for 3 to 5 times. So that will be really good when you start, and if you can progress that by doing the repetitions, which is really an effective one. Always be mindful of your posture during everyday activities like watching TV, washing dishes, or walking. So always make sure that you are staying active. Try to keep doing yoga, tai chi, and other kind of classes that focus on the body awareness. It's always a good idea to do exercise that strengthens your core muscles. So it's always a better thing to maintain your body weight. Extra weight can weaken your abdominal muscles, can cause problems for pelvis, spine, and contribute to low back pain. So always make sure that you are wearing comfortable footwear that is more appropriate for you. Avoid wearing heeled shoes. Low heel shoes would be preferable. So make sure work surface or comfortable height for you, whether you're sitting in front of a computer, making dinner, or eating a meal. So avoid static posture for a prolonged period of time. So make sure that every 30 minutes you are getting up from your workstation. So always ensure to engage your core muscles, example, deep abdominal and pelvic floor muscles during sternus activities, and breathe out as you lift. So this helps to stabilize your spine. Remember to maintain a neutral posture, as this helps the body to function optimally. Mindfulness is really a very good thing that you can practice always to uh, make your posture perfect. That's the best technique. So these were the references And thank you very much. Thanks for listening and thanks you for your time. Any questions?
Thank you, Brother Kavi, for an excellent and informative talk. I must admit, several times during your talk, I was trying to sit upright and then slouching and then sitting upright.
Yeah.
This really caused a lot of tension in me. So this has really been so effective, your talk, especially the simple exercises which we can incorporate in our day-to-day life was brilliant with all the pictures so that we can remember, what to do and how to do. I've got a few questions.
Yes, doctor.
And people with pain in their joints and muscles, when they start doing exercises,
Yeah.
they feel the pain increases. So they stop doing the exercises. What advice would you give, to them?
Absolutely. I have faced many cases like this. Motivation is the only important thing that we need to focus on. We need to find out what is causing the pain. So we will not start the exercises at the very early stage. If there is an active spasm, we will tend to reduce the spasm first. So doctors like you would be helping with medications if it is needed. But there are some people who don't, they are not keen on medications. So for those and for the people who take medications, we do advise to do the ice application. So ice is the best thing that would help reducing the muscle spasm. And there are some people who is not good with ice. They'll be, refusing to do icing. So in that case, we would advise them to go with the hot pack. It's always negotiable, for spasm. In my personal experience, the ice works better. And once after applying the ice, we need to gently stretch the muscles. So we need to get rid of the spasm and then we need to promote the exercises. So I think if we go gradually, I think people won't lose their interest. So it's not a good idea to always start doing the exercises because that would worsen the condition. So it's always a good idea to speak to the therapist and work together.
Yes.
Yeah.
And as you already mentioned, sort of over time, people just lose their interest and lapse, when they are a little bit better, then
Yeah.
they stop. Do they
Yes.
need periodic physiotherapy advice or physiotherapy just to motivate them or continuing their interest in exercising?
Yeah, that's why we would advise, after correcting the posture, it's a good habit to follow the exercises. And, if you feel that, because for everyone, things work differently. So we have to identify what works the best for us. So, once after correcting the posture, so maintaining the muscle strength and the flexibility by going to the gym, or if the physio is very much accessible for you, then obviously it's a good idea to go on a periodic visit to maintain the posture. So after some time, you will be adapting that habit and you won't require somebody's assistance to do that.
Okay, thank you.
Yeah. Yeah.
And you mentioned curvature of the spine.
Yeah.
How much of the curvature, or up to what percentage of the curvature, could be corrected by maintaining a good posture and doing regular exercises, meaning, without going in for surgery?
Oh, yeah, absolutely. Like, it depends again from patient to patient. When it is coming to the lumbosacral angle, when we do the postural assessment, so it will be like an imaginary line drawn between the base of the L5 bone and the first sacral segment. So if the degree is about 30 degrees, that would be more ideal. If it is increasing, your pelvic tilt increases and that puts more load on the lower back. So you can't always measure the thing. So what we can do is, like, we can listen to our body. So if the angle increases, then obviously the muscle imbalance would be taking place. So that would indicate through pain. So it's always a good idea to listen to your body and correct it when it is indicating through the pain.
Yes, thank you
Yeah,
so much.
yeah,
And lots of people use, spend loads on buying lumbar supports and braces and things
yeah,
for back pain.
yeah.
And what are your views, Brother Kavi?
Yeah, so definitely we would recommend the orthotic support that works. Again, we need to look into the stability of the joint. So if there is any issues in the stability, because when the bone is not only holded by the muscle, so the muscle is responsible for the mobility and the stability is maintained by the ligaments. So if we find that the stability is poor, then obviously we would be recommending for them to have a lumbar support. And sometimes the overacting muscle needs some resting position. So for that, the lumbar support works. And sometimes it works as a placebo effect as well. But we do refer the patient to the orthotics if it is not controlled.
And long term, you wouldn't recommend
No,
this.
definitely. So long term, we should not use any orthotic support because that will make your muscles weaker. So it's something like securing the part. For example, when you put the lumbosacral belt, that calms down your muscle. Once it is calmed down, then we should promote the strengthening and we need to maintain the posture rather than using the lumbar support for longer period of time. I've seen many patients who are, habituated to use the knee support for longer duration. So, and I have seen they have severely lost their muscles and the muscles gone for weakness. So, short period of time it is recommended and not for longer duration.
Thank you so
Yeah,
much. Yeah, that's probably will be very useful for everyone who are
exactly.
spending a lot of money and they feel the comfort by using it chronic and losing the muscle, causing muscle wasting and everything. Thank you so much,
True,
Brother
doctor.
Ravi.
Yeah,
And what are your views on acupuncture for, acute pain and then chronic pain too?
yeah. So acupuncture again, it do work, but it is questionable for long term because it is something that the pain would be coming again if you're not maintaining the posture. But for short term, definitely the acupuncture would help. But however, there are not much evidence. So there are, the beliefs and uh, there are people appreciate acupuncture and chiropractic and osteopath manipulations. Definitely it works, but it is not going to be a long-term effect. So it would definitely reduces the muscle spasm. And then we need to, adapt some good habits to maintain our posture. And we need to do the regular strengthening exercises and the postural awareness to have a better posture.
Yes, lots of patients say that, oh, my one leg is shorter than the other, and that is why I'm getting curvature. Uh,
Absolutely.
do you, in your practice, you must be
Yes.
coming across a lot of them, and
Yes.
how do you manage
Um,
it?
so usually the human body is asymmetric.
Mm.
Obviously, the limb length discrepancy is one of the major problem for the people to get scoliosis. So in that case, we do rely on the orthotic support. We will be measuring the length of the legs, the length of the extremities, and we will correct that using the shoe corrections. So, if there is a difference of about 1 to 1.5 inch, so nothing to worry about it. If it is more than that, then definitely we need to do the shoe corrections. Either we can place an insole or we can do raise it according to the discrepancy. And definitely that do work for the low back pain. So insole really works very well for the low back pain for people, you know, who have flat feet. So they tend to have the knock knees. So when there is a knock knee, obviously the gravitational force will be malaligned, and that will cause the poor effects on the lower back and results in back pain. So the insole placement and the shoe corrections played a major role in reducing the postural pain, and that works really.
Thank you. This will be
Yeah,
very useful for quite a few of us actually
yeah,
to remember or think about when we experience pain.
yeah,
And thank you for the picture about the looking at the phone.
yes.
That's something we all do, sort of. I don't know whether we need a stand somewhere where it's straight because we are all bending with neck
Yeah,
strain.
yeah,
So thank you so much for showing that picture and showing that the wrong how wrong it is to
yeah.
bend forward, which is a very common mistake we all do. So
True, true.
at least we will think about it from now on. Thank you, Brother Kavi, for making
Exactly.
very difficult topic very easy for us to understand, and
Yeah,
for giving us simple exercises which we can follow, and giving all the advice that we need to take responsibility for our health. Thank you very much. I'm sure all of us would have enjoyed this. And I would also like to thank our media team, Brother Seshan and Brother Tushar, for helping us with all the IT support in, sort of making this possible. I'm sure all of us will agree that we've gained enormous benefits from these health webinars, and we've learned quite a lot about the our own health by sort of following these health webinars. So we are very grateful to the National Healthcare Team for their commitment uh, to continue these health webinars and their hard work as well. Thank you. Most of all, I'd like to thank our beloved Bhagavan. uh, without his blessings, none of these activities will be possible, as we all know. So thank you, Swami, for everything. Our next webinar will be on the 7th of June. That's the Tuesday as well. So please be there and don't miss it. Jai Sai Ram. Thank you.
Sairam. Thank you, Doctor.